It is ideal to conduct laboratory testing for respiratory viruses of all SARI patients at a SARI Sentinel site. On the other hand, it is ideal to conduct laboratory testing for respiratory viruses of some ILI patients at an ILI Sentinel site. We therefore need a sampling strategy to select ILI patients for specimen collection for laboratory testing. Bias occurs when the selected patients at an ILI site are different in a particular way from all the patients together who visit that site and who visit health facilities generally. It is important that cases be selected in such a way that bias is reduced, so that the data collected depicts as truly as possible the distribution of risk factors, the impact of respiratory infection on different age groups, the general pattern of disease, and the data can be extrapolated to the total number of persons who present to healthcare facilities for care. For example, consistently selecting a sample of patients who attend a diabetic clinic on a certain day may lead to an overrepresentation of persons with diabetes as a risk factor. In general, the larger the proportion of cases from which clinical specimens for virologic testing are collected, the less bias that will be introduced. However, the total number of patients chosen for virologic testing will depend on the ability of the healthcare facility to process, to store, and to ship specimens, and it will also depend on the capacity of the laboratory to process, to store, and to test the samples. It is best to use a systematic approach for selecting cases, rather than to require healthcare providers to choose which patients to test. The approach should cover different times of the day and different days of the week every week, while providing reasonably representative data. The following systematic sampling methods to avoid potential bias can be used: interval sampling, alternate day sampling, and modified convenience sampling. Interval sampling is a straightforward method that would yield data similar to that from a random sampling strategy, and it would be to select every nth case at the Sentinel site. For example, every 5th or 7th or 10th patient that meets the case definition would be selected for testing and for data collection. Some previous knowledge of the volume of cases at the site is required so that the appropriate sampling interval can be selected. This type of sampling would likely require a designated person to be in charge of case selection on a daily basis. Alternate day sampling is another type of systematic sampling. This method is to select all patients who meet the case definition who present to a facility on a certain day or on certain days of the week. This can reduce the logistical challenges of surveillance by confining the laboratory specimen collection efforts to a certain day or to certain days of the week. In order to remove the bias introduced by differences in health-seeking behavior that may be associated with particular days of the week, the chosen day or the chosen days on which cases are selected should be systematically alternated from week to week. Modified convenience sampling is the third approach, and this involves testing the first X number of cases that meet the case definition. If this method is used, the time frame for selection should be systematically rotated in order to account for local health-seeking behaviors such as differential use of evening or weekend clinics, for example. So one way in which a site may go about this is to select the first 2 cases presenting to the health facility who meet the case definition in the morning, afternoon, and the evening of each day of the week, including, if relevant, on weekends. Care would need to be taken, however, not to introduce systematic biases in the types of cases that are selected. In this video, we have reviewed different ways of selecting a sample of the patients that present to health facilities for the purpose of epidemiological characterization and for laboratory testing.